We want you to get the best results that you can possibly for any cosmetic procedure, including Botox. So here are a few tips to help you get there. Hi, I'm Dr. Jordan Carqueville. I'm a Mohs surgeon and cosmetic dermatologist. I use neuromodulator, aka Botox, in my office every day. And so here are the top tips to get the best results. The first tip seems easy and obvious, but it's to choose the right provider. So this is going to be someone who's trained, it's someone who is an experienced practitioner, doctor, and who really has the experience under their belt. My practice is in a big city. There's a lot of injectors in the city. And so sometimes we see people who have not chosen the right provider. And some of the things that can go wrong might be an eyebrow droop or an eyebrow that's too high or Spock eyebrow. There's just different things, an uneven smile. So it's all about understanding the anatomy and injecting in those right places. So you really want to make sure that, again, whoever you're getting treated by is experienced and knows the anatomy of the face. Tip number 2 is to have realistic expectations. Botox is not a facelift. It's not necessarily going to change your whole face. And I think Botox is kind of about the subtleties. So it helps to reduce lines, wrinkles, but it doesn't make them disappear if they've been etched in for years and years. So we try to coach people to manage those expectations, but it can take a while to break habits of crushing the collagen in the muscles, and it can take a while to erase some of those lines. So remember, Botox is I call it the gateway drug. It's not a facelift, but it's a nice treatment to get started in a good aging plan and help reduce some of those lines. Tip number 3 is to remember some pre-treatment instructions. So while this is not imperative, and I never have anyone stop if they need it, but don't take aspirin, ibuprofen, or fish oil 2 weeks prior to an injection. Of course, if you need it for your cardiovascular health or you have really bad migraines or you need these medications, take them. Because really the worst thing that's going to be is a little bruise. So follow those tips, though, if you want to avoid bruise and have just an easy procedure. Tip number 4 is avoid touching or rubbing the area right after injection. So once we place it, it is placed. You don't have to do anything. I usually tell people make lots of muscle movements because it helps get that liquid where it needs to be to optimize the reaction. Because remember, Botox or neuromodulator injection is really a chemical reaction with your muscles. So don't rub it, don't push it anywhere, but make lots of muscle movements. And then you're good. The reaction takes about 4 hours, and then you can carry on with your normal life. Tip number 5 is be patient with the results. It takes 2 to 5 days for the results to start, and it takes at least a full 2 weeks to take on the full effect. Sometimes as that treatment is starting to work, you may not be perfectly symmetrical as it's working in some areas and not the others. So just be patient with it. If anyone in my practice needs a touch-up, I always say, please wait at least 2 weeks because I don't want to add more until I know that it is done reacting. So please be patient. When done right, Botox and neuromodulators can really give you a refreshed look and boost your confidence. Tips like you've heard today will really help set you up for success. If you want to hear more about this, please feel free to subscribe. Please add any comments or questions below. Thank you.